Cyril Ramaphosa's nephew stole money from Tembisa Hospital and bought the following cars. A Lamborghini, which cost around 10 million rands. Sorry, I made a mistake. Cyril Ramaphosa's nephew bought 4 Lamborghinis, which all came to 51 million rands. Just when you think you've heard it all, Cyril Ramaphosa's nephew Hangwani Maumela went on and bought a car worth 4.2 million rands. He bought a Bentley Continental GT. 4.2 million rands can go a long way in a hospital. Maumela, already tied to the 2.3 billion Tembisa Hospital looting syndicate, is now chasing another huge government contract. His company, Alu Construction and Supply, relied on a fake BEE certificate to bid. The tender was properly awarded to another company, yet Alu successfully obtained an interim to block the Mahican court from offering that company the tender. It is very sad that someone implicated in one of the country's largest hospital corruption syndicates can still try to win massive public contracts. He still wants more tenders after being implicated in looting 2.3 billion. This is very sad. Corrupt companies need to be blacklisted, a measure that would prevent many of these companies from reapplying for tenders all over the country. This is a tweet from Jeff Weeks. He says, for context, the picture of Morgan Maumela is a still from a video filmed at Edwin Sodi's fifth birthday. He was joined by Kate Matlala, Pule Mabe, TK Nziza, Lebohang Maile, and Kit Koza. Don't say there is no nexus. Another powerful tweet from Jeff Weeks reads, Babita Deokaran is the only reason anyone now knows the name Vusimuzi Kate Matlala. She paid the ultimate price, shot 12 times for reporting Tembisa Hospital corruption. This time, 4 years ago, she was preparing this document. 19 days before she was assassinated in August 2021, Babita Deokaran filed a report exposing 850 million in suspicious spending at Tembisa Hospital. 3 days after her murder, 6 hitmen were arrested. That is where progress stopped. Nothing ever happened until today. Simpiwe says, as much as Vusumuzu Kate Matlala enjoys a luxurious lifestyle, Hangwani Maumela is the mastermind of this whole corruption. Maumela had 9 companies supplying services to Tembisa Hospital. Maumela is the nephew of Cyril Ramaphosa. I bet the president will be shocked.
I think at a macro level, obviously, it would be just seen as a corrupt syndicate. But if we take it down and we break it down into a micro level, when healthcare workers are concerned, this is seriously concerning. I mean, in as far as the service delivery towards our patient and patient care in general is concerned. I mean, you would know that between the period of January and up to the last time I checked was in June, there's been a massive resignation of healthcare workers in that hospital, particularly Tembisa. Yeah. It's alleged that about 225 healthcare workers have resigned since the period of January until now. Of the 225, it's 147 nurses and 43 doctors, which then speaks to the morale of the staffing in terms of the Tembisa Hospital, which ultimately obviously impacts the direct type of patient care that we give to our patients. So this is unacceptable. 2 billion rands is diabolical at the very least.
Yeah. I mean, over 200 healthcare workers having resigned speaks to a much, much bigger problem. What are your thoughts when it comes to the gaps in governance which allow such syndicates to thrive within a public hospital? And what accountability structures do you think Samatu, would like to see unfold? I mean, you speak about 225. That's a substantial number for just one institution.
No, 100%. And of course, you and I would agree that, I mean, there's been a massive unemployed healthcare workers now in the country, stemming from 2 to 3 years ago, which was something that was never seen in the past. And this speaks directly to this rampant corruption that is running in our country. Now, what I want us to also just zoom in is to understand at the micro level what happens. Now, if you're having 2 billion rands that is allegedly siphoned from Tembisa Hospital, which I am more than certain that if you dig deep into the Gauteng Department of Health, you may be just surprised that it's not only Tembisa Hospital, it's just that it is Tembisa Hospital that was flagged. So in terms of the systems that could be put in place, I think you would also agree with me that South Africa generally does not have a financial problem. South Africa has a leadership crisis, and this is why we find ourselves here. So even with this massive corruption that has been uncovered by the SIU, we don't want, as healthcare workers, to find ourselves having to listen to another inquiry, another commission, another this that will not lead to arrest, that will not lead to those who are seen to be perpetuating such things to be held to account.